All right, well, for the sake of time, we want to respect everybody's time here. We're going to go ahead and get started. So thank you all so much for coming to our second MAID webinar, or our MAID for Health Justice Information session, frequently asked questions. Our last session, Introduction to MAID for Health Justice, can be found on our website, maidforhealthjustice.org. So please be sure to view that recording if you have not done so already. So today we are going to introduce ourselves again. For those of you who were not able to make it to the first webinar, we're going to let you all share a little bit about yourselves, and then we're going to go through the answers to questions, some of the questions that we've received since the call for application launched. After that, we'll have plenty of time to answer any additional questions from folks in this session. So as questions come up for you, please feel free to share them in the chat, and we will be sure to address them before the end of the webinar today. So we're going to start with introductions from our National Coordinating Office, and I'm going to go ahead and hand it over to Jamila to kick those off.
All right. Hi, everybody. Welcome to our second information session. So nice to see everyone here. I'm Jamila Porter. I am Chief of Staff at the de Beaumont Foundation and Principal Investigator for the MAID for Health Justice Initiative. And just as a means of introduction to the de Beaumont Foundation, for those who are new to us, de Beaumont is a philanthropic organization whose mission is to advance policy, build partnerships, and strengthen public health to create communities where people can achieve their best possible health. And at de Beaumont, we believe that every person should have the opportunity to achieve their best health. And in keeping with that belief, we create and invest in bold solutions that improve the health of communities across the country. So we're very excited to partner with the Robert Wood Johnson Foundation on MAID for Health Justice, which we believe will be a very transformative opportunity. So again, welcome, and it's nice to see everyone here. I'll turn it over to Joe and then Maddie to introduce themselves.
Thanks, Jamila. It is great to see so many people attending this. I'm Joe Gibson. I'm the Senior Project Director for the MAID Initiative.
And I am Maddie Kapoor. I am a Project Officer at the de Beaumont Foundation.
And my name is Cassandra Allen. I'm a Senior Programs Associate at the de Beaumont Foundation.
Okay, and now we're going to have our technical assistance providers, Public Health Informatics Institute and the Equitas, introduce themselves. These TA providers will provide support to awardees throughout the application process and then also throughout the initiative. So I'm going to hand it over to Vivian to start those introductions.
Sure, thank you, Maddie. My name is Vivian Singletary, and I am the Executive Director of the Public Health Informatics Institute. And for those that don't know us, our mission is focused on advancing health outcomes worldwide by guiding public health organizations to effectively access, use, and share information through the application of current and innovative information technologies. We have been around since 1992, and our focus is really on helping these organizations use information in a way that leads to good decisions, which lead to better interventions and better health outcomes. And our work is really about capturing, analyzing, transforming, and processing data so that it's clean and comprehensive and creates knowledge for decision-making. Our business is truly about information systems, and we're focused on building them to be sound so public health practitioners can work efficiently and effectively. The way that we work, we believe in very strong collaboration, and we have a history of achieving consensus among stakeholders and finding common approaches and solutions to some of the most challenging public health informatics problems. So we look forward, should you all on this phone become grantees related to this project, we really do look forward to the opportunity to work with you all directly. Thank you. Over to you, Sable.
Every time. Good morning and afternoon to you all. My name is Sable K. Nelson. I am an operations consultant for the Equitist. And the Equitist is a niche consulting firm that is dedicated to disrupting the status quo in public health and healthcare by infusing the tenets of health equity in healthcare leaders, institutions, and systems. We are so excited to be partnering with the de Beaumont Foundation and the other stakeholder groups and steering committee members to support the Made for Health Justice project that you all will learn a little bit more about in just a few moments. But a little bit about the Equitist. We were founded in 2020 at the height of the COVID-19 pandemic, and we really wanted to make sure that there were unique needs that were being met, unique needs that were developed across the different communities, across the country and around the world, that there were tailored and culturally specific solutions that were generated for that. And so we supported at state level responses, community level responses, and it goes toward the work that we do, which is providing consultative services in all things health equity. We are firmly rooted and believe that equity is rooted, inequity is rooted systemically across the healthcare and public health system. And we want to do everything to ensure that we embed and disrupt those systems of inequity so inequity can be mitigated and that folks can live full and prosperous lives. So definitely here to support you all if you all move forward through to the next phase, and looking forward to being able to help and support however we can in your process.
Wonderful. Thank you so much, Vivian and Sable. So now, as promised, we would love to get to know you all a little bit. So please start by just typing your name, your organization, and your location in the chat. Right, I see some responses coming in. We got folks from Connecticut, Los Angeles, DC, Alabama, Philadelphia, Ohio, another from DC. DC, lots of DC folks today, where de Beaumont is located right outside of Washington, DC. Los Angeles, Tucson, Arizona, Southeastern Michigan, Colorado, Nashville, Flint, Michigan, Oregon, Texas, awesome, Nebraska, Minneapolis, Pittsburgh, California. Wonderful. So please continue to share. We're so happy to see that we have so many people from different organizations across the country here today. And oh, forgot to share that. Yep. And then the next question we would like you to share the answer to is, what food is your region known for, and what is your favorite? So Joe and Jamila, I'm going to turn it to you all while everybody else is sharing their answers. Do you all have a favorite regional food that you would like to share with everyone?
Yes, I just put mine in the chat. I'm in Atlanta. We're soul food here, of course. So I put mac and cheese.
Nice.
But there's lots of other things I could put.
So we got some others: Southern home cooking, barbecue, Carolina barbecue, tacos. Nashville hot chicken, anything from New Orleans, pizza.
I love Cassandra said, I'd love to know what Nebraska is known for, which I would too.
Cheesesteaks.
So
Joe, what about you?
Yeah, I'm in Indianapolis, so pork tenderloin is our big fair food. We've got all sorts of crazy fair foods. I guess most people probably do now, like deep fried butter, stuff like that. So not necessarily healthy stuff, but a lot of fun food.
I didn't know Indianapolis was known for pork tenderloin. Now I know.
It's the thing.
Pierogies.
Elizabeth in Portland said donuts, which donuts are my favorite dessert. Also, my favorite donut place is in Seattle, Top Pot Donuts, for anyone who's ever been there. Yes. So yeah, the Pacific Northwest has it on donuts for sure.
Fried gator. All right. Okay. Oh, we need the name of the donut place again, Jamila.
I will drop the link.
Excellent. Nebraska is known for beef. Makes sense. Colorado pork green chili, yum. All right, well, now I'm just hungry for lunch. So I guess I did that to myself with this question. But thank you all for sharing, and please continue to share in the chat if you haven't already. Regional foods, I feel like I learned something today as well. So we're just going to do a really quick overview of the grant if there are folks on the webinar that were unable to make it to our first information session. But again, I do encourage you all to go back and watch the recording if you did miss that one. So Modernize Anti-Racist Data Ecosystems, or MADE for Health Justice, is a multi-year grant opportunity supported through a partnership between the Robert Wood Johnson Foundation and the de Beaumont Foundation. Through MADE for Health Justice, we seek to accelerate the development of health-focused local data ecosystems that center principles of anti-racism, equity, justice, and community power. Through this opportunity, nonprofit organizations will be funded to build and facilitate multi-sector teams tasked with creating local data ecosystems. And these data ecosystems must focus on improving community health, connecting data across multiple sectors of local government, prioritizing the needs and voices of communities oppressed by structural racism, and ultimately driving just and equity-centered decision-making. These are just a few of the details about the applicant teams and award structures. So up to 5 grants will be awarded. The grant ceiling is $1 million over the 3-year project period, which will range from June 2023 to June 2026. A proposed team must include at a minimum a nonprofit organization that will serve as the applicant and lead organization, and 2 local government entities that represent at least 2 different sectors, such as public health, housing, employment, community development, etc. The entities might be government agencies, they might be departments within government agencies, programs, or any other unit of government. And they will serve as contributors of local population-based data and or analytical services to the initiative. And while 1 nonprofit plus 2 government entities is the minimum requirement, a proposed team should include all organizations needed to make the initiative successful and sustainable. And these initiatives should change the local data ecosystem, which in many places may require the involvement of a variety of other public and private organizations. Okay, so now we are going to, or I'm going to really quickly walk you through the Made for Health Justice website. Are you all able to see that on the screen, or do I need to reshare? Okay, great. Okay, so this is the Made for Health Justice website. There are just a few things that we need to, or that we wanted to draw your attention to. And so first, you'll notice that when you go to this homepage, there are a few different options here. One of those options are FAQs. And so if you click on that, you'll see some questions that we have put the answers to preemptively on the website. So I encourage, if everybody has lingering questions after this webinar, to go and take a look at this page. And we also plan to put all of the questions that we address in this webinar on the FAQs page in the coming days. Another thing that I would like to call your attention to is this call for applications tab. This is the call for applications. And there are a couple of different things on here that folks might be interested in looking at. So if you look right here in the third column, there is an option that says application scoring criteria. And if you open that up, you actually can see the rubric that we're going to be using to score applications. So I encourage everybody to take a look at that as you are completing your applications. Another thing that you can see is the if you look down here, so there's a call for applications PDF version that might be useful for some folks. And then down here, we have eligibility in phase 1 application questions. And that is actually a depiction of what the application looks like on the website Foundant, which is where you actually submit your application. So that might be useful to some people if you want to take a look at all of the different eligibility questions that you'll have to answer. And have an idea of what it'll actually look like in the Foundant website. And then of course, over here where it says submit application, if you click on that, it'll redirect you to the Foundant website where you can actually submit your application. Joe and Jamila, is there anything that you all wanted to add about the website walkthrough before I move on?
No, I don't have anything, but just to make it easy for everyone, everything where Maddie is showing that landing page has links to everything.
Yeah, and I point out that that table of contents up top is useful for jumping around. There's a, the second to last item is the key dates. That'll tell you when everything's due and how the process is gonna move along. But the whole CFA is certainly something everyone should read is when they do the application.
And someone asked, I just put the link in the chat, but the rubric is also can be found in that gray box, application scoring criteria.
Mm-hmm. Thank you.
And you'll also find the recordings of these webinars on that page.
Perfect. All right, I'm going to close out of that and move us on. All right, and I'm going to go ahead and hand it over to Jamila for our next section.
Great, thank you, Maddie. So now we'll talk through answers to a few questions that we've received since we've launched the call for applications a few weeks ago. So in the coming days, these will be added to that FAQ page that you saw. And so just know that those will add some of these questions that we're going to cover today, as well as questions that we hope to get from you all and others in the coming weeks. So we'll start walking through some of these. So one we got was, is my organization a good candidate to apply for Made for Health Justice? Great question. So the answer to this one really is around the eligibility. So that's on the call for applications page. This is directly pulled from that. Basically, there are 5 major eligibility criteria. An applicant organization has to be a 501c3 or 501c4 organization that is tax exempt under those 2 sections in good standing with the Internal Revenue Service and not a private foundation or non-functionally integrated type 3 supporting organization. If you don't know what that is, ask your accountant, they definitely know. Colleges and universities, whether public or private, are ineligible to serve as applicant organizations. Next is that the organization that's applying must have a mission or priorities that focus on serving communities of color and addressing structural racism, equity, and justice. There will be ways to convey that in the application, but basically, if an organization, no matter what they're topically focused on, that was very open, and that's also described in the call for applications. We intentionally want applications from across what we would call the social determinants of health, working in the built environment space, housing, education, and we'll talk through those sectors too, but we're intentionally broad there. There just has to be either priorities or a mission focused on supporting communities of color and addressing racism, equity, and justice. Next, the organization needs to be either engaged in community power building activities, like, for example, grassroots advocacy or community organizing, and there are other examples that we have in the call for applications. Or the applicant organization must have an established partnership with an organization that engages in this work. An applicant organization must have established partnerships with local government entities across at least 2 sectors, and entities is intentionally broad, meaning organizations, departments, agencies, programs, etc. And an applicant organization must be based in the United States, within US territories, or within lands of tribal entities that are recognized under US federal law. So as promised, this question, what are sectors of interest for Made for Health Justice? So the sectors that we are primarily interested in receiving applications around, and mind you, this is a multi-sectoral opportunity. So we want applications that are trying to build connections between 2 or more sectors. So those would include, and Maddie, can you move it to the next one? Thank you. City, county, regional, and tribal management, civic engagement and participation, community development, economics, income, taxes, and wealth, education, housing, labor and employment, land use, planning, zoning, and the built environment, legal and carceral systems, public health, and transportation and public transit. So very broadly, these are the areas that we're interested in seeing connections across within applications that are applying for this opportunity. This question, what are some examples of potential health equity goals, sectors, and local government partners? Now, the response to this one was very fun because we got this question during the info session. And so our team got the fun opportunity to try to apply for our own grant opportunity, which is great. So we'll look at some examples here, and apologies if the table is a little small. We just want to try to fit it all in here. So what you see here in the first column are some sample health equity goals, and then the sectors that would be involved, and then potential local government partners. And so I'll walk through these just to give you a flavor for what we're thinking. Might be some, these are just examples. And so we really want folks to take that in that spirit. And just as a note, we came up with these examples based on regions of the country and sectors that we're familiar with. So again, this is not meant to be exhaustive. And if in this conversation you have questions about health equity goals, feel free to ask with us here, and you can always send us an email as well. So starting with the health equity goals, these examples, broadly, what I would say is that we would really encourage health equity goals to be visionary and very upstream, as upstream as you can get, and then also be very clear about the specific communities or neighborhoods that would be the focus of the health-focused local data ecosystem. So in these examples, the first one, we'll just walk across each row. So if a sample health equity goal could be provide safe, affordable, and desirable housing for the residents of the Ville neighborhood of St. Louis, Missouri. The sectors that could be involved would be community development, housing, and land use planning, zoning, and the built environment. And potential local government partners could be the St. Louis Housing Board of Commissioners, the City of St. Louis Office of Housing and Community Development, and the St. Louis Office of Zoning and Development. Another example of a health equity goal: fund Prince George's County, Maryland schools equitably to ensure every student has the resources they need to obtain a high quality K-12 public education. So sectors that could be involved include, but are not limited to, economics, income, taxes and wealth, and education. And potential local government partners could be Prince George's County Public Schools and Prince George's County finance offices. A third sample goal: implement high quality, efficient, and reliable public transportation services in Clayton County, Georgia, that allow residents to successfully reach employment centers and recreational destinations from their homes. So the sectors that could be involved here would be community development, economics, income, taxes and wealth, and transportation and public transit. And potential local government partners could be the Metro Atlanta Rapid Transit Authority, or MARTA, the City of Atlanta Office of Housing and Community Development, and the Clayton County Department of Labor. The fourth one we have here: allocate public funds for services in North and South Sacramento, California, in alignment with what residents deem to be high priority and will support longer, healthier lives. Sectors involved here could be the city, county, regional, and tribal management, civic engagement and participation, land use, planning, zoning, and the built environment, and transportation and public transit. And you'll see here for local government partners, this is a real initiative. So we have a link here. The Sacramento Office of the City Manager Participatory Budgeting Pilot Program. They could also include, so this is an example, but there is a real pilot program for participatory budgeting, but that would be an example of civic engagement. Also, potential partners could be the Sacramento Department of Recreation, Parks and Tourism Administration, Sacramento County Department of Transportation, and the Sacramento County Health Department. And then the final one we have here, the health equity goal could be improve the quality of farmland and agriculture-related economic opportunities among the Navajo Nation in Apache County, Arizona, to ensure access to nutritious foods aligned with tribal practices. So sectors involved here could be community development, public health, and land use, planning, zoning, and the built environment. And potential government partners could be the Navajo Nation Department of Health, the Arizona Department of Agriculture, and the Intertribal Council of Arizona. That's a walkthrough for those. And then because you saw in that last example, Arizona, a state government entity, a good question that we got was, can state government entities count as local governments in places where they directly provide locally focused services? And the answer to this question is yes. We understand, I will read this, but try to keep it brief. So we understand that in some situations, state governments and other entities as well functionally serve in the role of local governments and provide county or municipal level services that a local government would provide in other states. So we completely understand this. This is acceptable. We would just ask that this information and the rationale for including state entities or other entities, sometimes universities provide sort of fill in roles as like a local public health as an example. So we just ask that this information and the rationale is clearly described in the application. So now I will turn it over to Joe to answer some questions.
Thanks, Jamila. So the first question here is, what are some other organizations that could be part of the proposed team? And as you heard from Maddie earlier, we want teams to include whatever organizations are necessary to make the initiative successful. And then Jamila's examples gave you some idea of some of the spectrum that might be included. So other organizations that could be part of the proposed teams include, but are not limited to, local branches of national community organizations, other community-based organizations, other local government entities, local foundations, organizations specializing in community data, colleges and universities and businesses. So you'll see, although we said that colleges and universities can't be the primary applicant, they can certainly be involved. Local branches of national community organizations might be things like the local United Way, the local Urban League, or LIS. The organizations that specialize in community data, often there'll be a part of a university, like part of a business school or a public policy school, that has a shop that actually does a lot of data analysis and provides data to local organizations that might be a good partner for this. If you have a local partner who's in the National Neighborhood Indicators Partnership or in Civitas, those are two national organizations that have a lot of local organizations that serve local organizations with data and try to promote data for them. A local government entity could be an elected office, an elected official's office. So the spectrum could be anything. It's really about what's necessary to make the initiative successful in your location. Are there supports in place for small nonprofits to act as a lead organization? So we know that this is a large grant, it's $1 million over 3 years. And some nonprofits may not have the administrative capacity to manage that, but we don't want that to stop them from applying. So next slide, Maya. Yeah. So if this, for instance, if there's a small nonprofit that doesn't have finance staff and they make it through to phase 2 of the application process, we will work with them to ensure that their phase 2 proposal includes a plan and budget for getting the administrative support they need to manage the financial side of this grant. We don't want the lack of current capabilities to stop a great idea and a great local organization from applying for this grant. Next slide. Does our team need to have a data sharing agreement in place by the time we submit our application? Next slide. So the strongest applications will have data sharing agreements in place before submission. We know that it often takes a long time to get access to data. This is a three-year project, and sometimes it takes years to get access to data. So with these initiatives, having only 3 years of funding, we'll be looking for initiatives that have confirmed access to the essential data for the initiatives, including data from at least 2 sectors. Now, the initiatives may add data along the way and may get access to additional data over the 3 years, but we'd like to know that upfront they at least have access to the essential data from at least 2 different sectors for the project. Can we vet our ideas through you before applying? Next slide. We may not be able, we will be unable to provide detailed feedback to phase 1 applicants, but we'll answer all the email inquiries that we receive as quickly as we can. And we're happy to answer any specific questions about proposed initiatives. The email address, if you send an email to info@madeforhealthjustice.org, you can see at the bottom of this slide, the madeforhealthjustice.org site. And if you send an email to info at that domain, then we'll respond to you as quickly as we can. Maddie?
All right. Thank you, everybody, for the questions that you've already posted in the chat box. And it looks like a lot of them have also been answered already. So I'm just gonna go through, and actually while I'm doing that, it looks like Colin has a question. So go ahead, Colin, unmute yourself and ask your question.
Thank you so much for giving us this opportunity, for posing this grant. It's enormously exciting. I'd emailed about this question, but hadn't got a response, so I'll ask it here. Our organization is a grassroots organization run by and for people with disabilities. Here in Massachusetts, the lack of public health data collection on disability had catastrophic consequences during the pandemic. We've now developed a partnership with the Department of Public Health. We're just trying to address that. Obviously, there are substantial intersections with race because of the impacts of environmental racism, meaning that certain disabilities are vastly more common in communities of color. But would a project focus primarily on combating structural ableism be appropriate for this grant?
Thanks for that question, Colin. I think the answer to that one is, of course, as you just described, taking on structural ableism. Ableism is like one more of the isms that we need an intersectional approach to address. So what I would say is that because this particular opportunity is centered on addressing structural racism, the lead applicant organization would need to have that focus. They would need to be focused on addressing structural racism, equity, justice, and serving communities of color. But we would, of course, invite that additional partners that are part of the application should have that intersectional lens. So it would absolutely, we would love to have one where additional partners at the table for that application would also be taking on systemic ableism, as you just described it.
Great, thank you.
Okay, I see a question from Tyler about submitting a mixed methods application, i.e. can you submit video responses for some of the application questions and narratives for others?
So this is the first time we've gotten this question, Tyler. I would say to if possible, we'd like an application that chooses a team. So either give us all video responses or all narrative responses, just by nature of like literal humans will be reading through the application and want to make sure that we have all of the information that we need to have at our disposal. So, you know, be kind and give us one of those formats. But I appreciate you bringing that up too, Tyler, because we included the video option just to kind of try to disrupt how these, you know, grant application processes work. And sometimes being able to convey information via video or, you know, picturesquely is helpful and more important. So if the video option is selected by the organization that you represent, we'll look forward to reviewing it because there's no preference for a video or narrative-based application.
All right, I'm not seeing any other questions that we haven't addressed yet in the chat. So feel free, any folks who have any additional questions, to share them. Can your team consist of 2 departments within the local government?
I'm guessing, Betty, you are asking, can both departments exist in the same government agency? If that's the case, then yes, that is possible as long as addressing 2 different sectors.
Hi. Yeah. So what's happening, let me not be rude. What's happening with the redevelopment, say if I'm working with the redevelopment authority, they're all a part of the city local government. But if I'm working with the redevelopment authority and they're part of our team, along with, say, 3rd District Council, and they're part of the team as well. So you're saying that this is allowable for me to state, yes, well, they're part of my team.
Mm-hmm. Yes.
Perfect.
Absolutely. The one thing we haven't talked about, and I should have talked about in the table, is that we didn't talk about what data might be connected across these sectors. So that's the other thing I'll just add here, is to make that we're expecting that the government partners, whomever they may be, and again, 2 is the minimum, so there could be many more, are bringing data to bear to be connected, and or providing data analysis and support services as well. So I just wanted to uplift that since I didn't mention it earlier.
Yes, the data that say, for example, the redevelopment authority is articulating is, say, with land use and things of that nature. They've been very, very instrumental about this. But then on the other hand, I have a letter of support the 3rd District Council. So I don't know if that's allowed.
I would say yes. So my understanding, the 3rd District Council is like this, like city council?
Yes.
Yes, they can definitely be part of the team.
Yes, because without them, we could not do anything, without this letter of support.
Understood. Absolutely. So yes, 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 yes. Thank you, Betty.
Thank you.
Okay, we have another question about data. Can we use publicly available data? A lot of elections data is publicly available, sometimes with a small cost, but building the connection between both elections and public health data hasn't been done much. Elections department can be elusive when trying to build an actual relationship, and they often cite their data being public already.
The answer is yes. The data can be publicly available. I think that what the expectation is that there are government partners that are part of the team that are going to be doing something differently with either how they use the data, helping to connect the data. There's got to be some investment made from a government entity / partner. So and also the elections data could be connected to public health data, but what are the question really there is what government entities have authority over either how these data are utilized, how they drive decision-making, how they can be connected to each other. Those would be the questions that we would ask. So short answer is yes, but there's some expectation that government partners are supporting connections and what goes next in terms of decision-making used with the data. Joe, go ahead.
Yes, if I can add a little bit to that. The goal here is to influence the data ecosystem, or evolve the data ecosystem. So this is not just a one-off project where you get a data set and you do something with it. We're trying to create a system that's going to support initiatives toward improving equity in the community over the long term. So, a one-shot deal isn't going to do it. We want to build a system where the data sources can continually be matched together to address the equity issues that are identified in the community.
So just building on that a little bit too, Nora, I would say it's what are the routine systems, processes, practices in local government that could be changed using the connections that might be made across the data sets? That's another question to add to Joe's contribution.
Okay, and Tyler, go ahead.
Yeah, so since this is a 3-year project, I wanted to make sure that there's opportunity to be able to alter the sort of data sets that you try to use throughout the project period, as well as refine maybe some of the data collected by the tribal entity, the tribal health department, whatnot, and be able to see maybe is it worthwhile collecting these variables on, looking at this topic. Okay, if not, stop collecting them, and then try these. So it's kind of like a trial and error to maybe see what variables are actually good indicators of certain outcomes. And so I just want to make sure that there's room to kind of refine that sort of data collection and what variables we are collecting.
So I'll do it looks like, Joe, you might really want to jump into this, but the short answer, Tyler, is yes, absolutely. We would expect that improving data sets, changing them, altering them, adding data. One of the things might be we've been using a lot of quantitative data, but we don't have richness about what's happening with lived experience. You would add some qualitative data sets to and connect them, into this larger ecosystem. So short answer is absolutely.
Yeah, Jamila covered it. I'm sure these projects will look very different at the end than the initial plan because they evolve. That's going to happen.
But I think data improvement is and improvement with the end game of improving not just the ecosystem itself, but how the data are used to improve, to drive the health equity goal. I think that's always sort of the lodestar for us.
All right, and Elise is asking in the chat box, can the aim be to improve the quality of the data that's being collected, or would there need to be more data infrastructure expansion that needs to happen as well? So similar question.
If I can take a step, the goal is the health equity goal. And so the data operations or whatever you need to support that health equity goal, that could involve, maybe in some instances, maybe it's just about data quality. I'd be a little surprised. It's probably going to involve a lot more involvement by the community-based organizations and community members in the data processes and figuring out what questions are asked, how the data is used, how results are interpreted, how results are shared. So I expect there'd be a lot of that. But really, the goal is the health equity goal, and the data, whatever goes on with the data is in service to that.
And there was just one more question that was asked earlier. I know there wasn't a clarification, but if the center housing university was the primary lead, can they be an applicant? And if they are not the primary or lead, can they serve in the local government role that was described? Can you clarify that for Jeff, please?
Yeah, so Jeff and I also chatted earlier. So I just will say we would have to look at that more closely because universities are ineligible to serve as lead applicants. But if there's a compelling case that can be made about the nature of the center, I don't have any details at this juncture. We tell us, and I would welcome everyone to do that. If there's like, well, we have this going on, but what about that? Like, send those to us and let us. We were happy to take those on a case by case and read through them and give you a response. The general sense, right, is that we're focused on local government and universities are ineligible. But if certain entities are filling certain roles and it makes sense and it's going to drive that health equity goal as Joe was just describing, and also if it's going to help support the sustainability of this ecosystem. And so I think that's another takeaway that we want to drive home is that, just as Tyler noted earlier, it's a 3-year project, but the goal here is that it lives and lasts well beyond that. So this is why we're looking for stronger applications will have established partnerships with their local government entities, established partnerships with partners that are doing community power building or they themselves are doing that work. These are all elements that we're honestly testing to see to what extent can we create health-focused local data ecosystems that are driving health equity goals and that will last beyond this opportunity.
And just to add a little bit to that, there are clearly a lot of variability around the country in terms of who plays what role in a community around data. We probably would not be supportive of a university center being in place of a government organization if there is a government organization in that locality who could fill that role. So if there is no government entity that's doing the whatever economic support or something, maybe that could be government centered. But if there's a government entity that is in there, we want to see that government entity involved.
All right, and I want to give everybody a final opportunity to leave your question in the chat box, or if you'd rather raise your hand to ask it, feel free. Okay. Well, in that case, I'm going to go ahead and hand it off to Jamila to finish up our information session.
Great. Well, again, everyone, thank you so much. This was a wonderful forum. We really appreciate all the questions that you've already asked us. Please ask us more. If anything seems unclear or if it seems complex, nuanced, please, we're excited for those kinds of questions. Just want to also note applications are open and they will be open through August 31st, 2022 at 11:59 p.m. Eastern. So please ask us questions in the meantime. We'll be looking forward to getting phase 1 applications from folks, and we're really excited to see the variety and the depth of ideas and collaborations that will be proposed. So again, thank you all so very much. Again, please share any additional questions that you have for us at info@madeforhealthjustice.org. And don't forget to check out the FAQs. They'll be updated with these questions pretty soon. And we will also upload copies of the slides from today's presentation and from the introductory presentation if they're not already up. So we'll make sure we get those up for everyone as resources as well. All right, thank you all so much. Have a wonderful rest of your day, and we hope to hear from many of you.
We got a last minute question from Betty about application codes. Do you know?
Way to slide it right under.
Yeah.
Application code automatically sent out. This is a Joe question.
You can ignore that application code field. That's something that we'll use if somebody's having a special problem with the form, but you should not need an application code. You apply, you'll create an account in our application system, and you'll use the login and the password that you used for that account to access the application. To get back in, you can work on it and save it and then go back and finish it up later. So you should not need an application code. If there's a problem with that, you can send me an email and I can try to work it out. Or send an email to the info email address there.
All right, thanks everybody.
Thanks.